Does your knee give out, buckle, or lock up? In this video, I'm going to teach you what you can do to fix this. What's going on, guys? My name is Dr. Nick Bonforte, physical therapist. So when you hear things at the knee like giving out, buckling, feels like it locks up, those things are typically associated with meniscus problems. Now, depending on the severity of the meniscus problem or a tear, healing can vary. So typically there's these zones or layers in the meniscus. When we have a tear or a strain to the outer zone of the meniscus, it tends to heal just fine. But when we go deeper and deeper into the knee, deeper zones of the meniscus, that's when healing rates can vary, and it might be a little bit more of a problem if you have a tear in the deeper zones versus an outer edge zone of the meniscus. Let's dive into a few exercises that are addressing meniscus tears. A lot of the exercises that you're gonna see are ones that I use directly in the clinic with the clients that I have that are experiencing meniscus problems, and they seem to do really well with these types of patients. All right, so the first up is windshield wipers. The idea with this is we're helping the knee rotate better. With meniscus problems, rotation at the knee seems to be a limiting factor. It could contribute to some of the irritation you might be experiencing at the meniscus. So we're grabbing underneath the knee, holding it, we're flexing the ankle up to the shin as much as possible. And then from here, we're just turning the ankle out or the whole leg out and then the whole leg in. And the idea with this is we're locking at the ankle so we can create rotation at the knee. By improving, again, the rotation at the knee, it helps the knee actually move a little bit better. The knee doesn't just straighten and bend, it actually rotates. So when we lack this rotation, that can contribute to some of the issues for meniscus problems. So from here, we're just holding underneath the knee, locking at the ankle, and going in and out, working on the rotation at the knee joint. Next up is bridge with a march. We're just working on some glute strengthening while we're not weight bearing on the knee. When we're dealing with meniscus problems, many times, depending on the stage you're in, a lot of weight bearing compressive forces can bother it. So you deload it, you go kind of non-weight bearing, even though there's a little bit of load going through it when the legs are down. Here's how it looks. We're here driving through the heels, raising your pelvis up. You maintain that height, and then you're gonna just march with both legs, and then you come back down, really feeling the glutes and the hamstrings working. So I drive pelvis up, march, and with this, the concept is we're addressing the hip stabilization to ultimately help at the knee itself. Make sure toes stay up. That will help emphasize more of the glutes working. Next up, we're working on knee flexion gapping. So you're taking a shirt rolled up, a towel, whatever it is, you get it right underneath the knee and you pull up. From here, you lie down, you're just gonna bend the knee and then use the other leg just to overpressure it a little bit. So with this concept, we're creating this gapping at the knee. So inside the knee, when we bend the knee, it's not pinching on the meniscus. This helps gap it a little bit and tends to respond really well for the knee when we again are dealing with this type of knee meniscus problem. So you just want to monitor how hard you're actually pulling. So you want to pull not to the point where it's uncomfortable to the knee, but it feels obviously good if you're experiencing any of that discomfort. The opposite leg is just adding for a little bit of overpressure. There you go. Those are exercises that can help with meniscus associated symptoms. They seem to do really well with these types of clients that I deal with that are experiencing, again, from a meniscus tear. So hopefully you understand and learned a little bit more about things that you could do to target the knee when you're dealing with meniscus-like symptoms. So guys, I'd really appreciate it. To help out with the YouTube algorithm, subscribe, like, comment, leave any questions down below. I'll get back to them as soon as I can. Turn on your post notifications so you never miss a video. This is Dr. Nick. I'll see you next time.